Hello to all of you at the Student Convention on Psychological Research and the International Congress on Psychological Research in Mexico City. I'm Professor Robert Enright from the Department of Educational Psychology at the University of Wisconsin in Madison, where I've been a professor for over 30 years. And I want to thank Rodrigo Rosales for inviting me to talk with you today about a book I recently had published with my psychiatrist friend, Dr. Richard Fitzgibbons. And that book is Forgiveness Therapy, an empirical guide for resolving anger and restoring hope. It's published by the American Psychological Association. It's actually a second edition of a book that was published in the year 2000, Helping Clients Forgive. And in those 16 years, we have been delighted and surprised by the explosion of interest in the topic of forgiveness in the social science of moral development and in the therapeutic sciences. And the reason, I think, for this interest is because forgiveness is now seen as a major component for emotional healing and well-being. Where before our work, which began in 1985 at the University of Wisconsin, there was actually very little, if any, thought to the idea that forgiveness can have a place within the psychological sciences. And our job over these past years has been to show that forgiveness has a viable, reasonable place within psychology, to do the research on forgiveness therapy and forgiveness education, and to make it simple enough so that busy clinical psychologists, counseling psychologists, and psychiatrists can understand what forgiveness is and appropriate it in their practices alongside their other offerings, whether it's humanistic psychology or psychoanalytic therapy or cognitive behavioral. Forgiveness therapy can fit alongside all of these. So with that in mind, I would like to go over this book, Forgiveness Therapy, with you in the next 40 minutes or so by going over the following chapters. First of all, we're going to start with chapter 1, and we're going to look at the theme of anger within an individual and how anger can compromise a person's life. Then we're going to move to chapter 2, where we're going to try and deepen our understanding of what forgiveness is and is not. I want to define it for you so that you have a clear sense of what we mean when we use the word forgiveness and when we use it in the context of therapy. Then we're going to move to chapter 4, where we're going to look at what we call the process model of forgiveness. Here we have an ongoing set of activities that we ask the client or the patient to engage in as they move through the forgiveness process. We'll then move to some empirical validation of forgiveness. We're going to talk about our research, in other words, from chapter 5 of the book. Then we'll look at chapter 6, particularly forgiveness therapy in the context of the depressive disorders. And then we'll look at chapter 12 with forgiveness education. It's an extension of what we've done with adults, and this takes place in the context of classrooms with regular classroom teachers doing the instruction. We'll describe a little bit about what the instruction is like and what the students end up looking like in terms of their psychological profiles. We'll then look a little bit at measuring forgiveness, the degree to which one person forgives another. In other words, if you're going to do good therapy, you should be able to have a marker for the degree to which someone is actually forgiving another. And then we'll end with some skeptical views, and that will end our session together. Well, let's take a look at Chapter 1. I'm going to turn to page 17 here for a moment. And here we see the crux, or the gist, of what forgiveness therapy actually is, what we think it can actually accomplish or not accomplish. And here's a very important point to keep in mind. Forgiveness therapy primarily targets unhealthy anger. It targets what we call persistent resentment. And this theme of anger or persistent resentment has not been given the attention that it should be given within the therapeutic sciences. Yes, we focus on depression. Yes, we focus on anxiety. Yes, we focus on low self-esteem. But you don't see much about how to treat people who come in who are very, very angry about being treated unjustly or unfairly by other people. And that's where forgiveness therapy centers, on people's unhealthy reactions to unjust or unfair treatment. And so when we talk about this theme of forgiveness and unhealthy anger, let me tell you, first of all, what we mean by unhealthy anger. And it starts really on page 15 rather than 17. The anger that is in the context of forgiveness therapy is focused on other people, not on events. In other words, if there's a hurricane or a tornado, these are not forgivable because we forgive persons rather than inanimate objects. The anger that requires therapy is usually very intense and not short-term. It is a pattern that can become a part of the person's life where it's persistent. The anger can be extreme either in its overt, outward manifestation or in its passivity. In other words, someone can have deep, intensive anger, and it is passive, held within, not expressed much at all. But that kind of passive anger can eat away at a person's happiness and well-being. The anger abides. The anger is based on real injustice rather than imagined injustice. In other words, if a person has a narcissistic personality and they're very, very intensely angry because they think someone didn't honor them in the right way, that's not going to be the kind of problem presenting itself that would be conducive to forgiveness therapy. Instead, we'd take another tack on that, which would be to try and get insight into the narcissism first. But if it's a real injustice that happens from someone who has concretely hurt you in a way that you truly can understand, then forgiveness therapy comes on board. Then forgiveness therapy could be appropriate in not only reducing that anger, but reducing depression and anxiety and low self-esteem as well. So what is forgiveness? Forgiveness is defined this way. Forgiveness has three components to it. First of all, as I have just mentioned, you have been treated unfairly. So that's the first issue. It's in the context of unfair treatment. Second of all, when you forgive, you get rid of the resentment, the toxic anger, that abiding, intense anger that stays with you, and you work on reducing that. And third, by offering goodness to the person who has been unfair to you. Now, right there we should stop and just take a look at those words for a moment. You are being good to those who have not been good to you. That seems outrageous. It seems unreasonable. And it almost seems like forgiveness therapy is unfair when that's actually a misunderstanding of what forgiveness is. You see, forgiveness is not centered on the virtuous quality of justice. Instead, forgiveness is centered on the virtuous quality of mercy, giving people more than they deserve, going beyond justice to goodness beyond justice. When you give money to the poor, you are being merciful to that person. When you refrain from keeping a child in his or her room as a punishment for as long as you said you would, and you are pardoning them, that's a form of mercy. And forgiveness is a particular form of mercy by being good specifically to those who have not been good to you. I think it's the hardest kind of mercy, because you are giving goodness to those who have hurt you, where you still might have this anger. You might have confusion. You might have an ambivalence toward this person. And you might not even want to be good to the person. You might not feel like being good to the person. But you are good nonetheless. So let's take a look at chapter 2, page 41, where we are going to take a look at what forgiveness is not. And on 41, you're going to see that forgiveness is not reconciliation. To forgive and to reconcile are not the same thing. For example, when you reconcile with another, you trust that person. You come together again then in mutual trust. And when you do that, if you think about it, reconciliation is not a moral virtue. It's a negotiation strategy between two or more people coming together again. Forgiveness, on the other hand, is a virtue, a moral virtue, like justice, patience, kindness. It starts from within and then flows out to the other for good. In contrast, reconciliation is two people working their way back together again in some kind of mutual trust. Forgiveness is not the same thing as pardon. When the parent says you will stay in your room for an hour to a child and then lets the child out in 20 minutes, they are pardoning them from the rest of the punishment. But that's not forgiveness. The parent still could be angry, could still have persistent resentment toward that child, still might not think of the child as having goodness because the parent is so angry with the child. So to pardon and to forgive are not the same thing. To excuse is not the same thing as to forgive, because to excuse is not a moral virtue. And so when you think about it that way, whenever you are dealing with another human being and you excuse them, you might do so and you're still very angry with them. You're dismissing them as a human being. You're dismissing them as a person. And so you have to be very, very careful with that. When you take a look at page 41 and the checklist that we have, there are many views of what forgiveness is not. It's not forgetting, right? It's not becoming tolerant, because you can become tolerant with still this abiding sense of anger within you. Forgiveness is not the same as common expressions that we use. Sometimes we say things like, I accept what happened, knowing that we're just going to let it go. Well, to forgive is not to let go of what happened, it's to accept a person. And another expression might be, I like to let the person know how much he or she owes me when I forgive. To forgive is not to put you on a higher moral plane than the other person, but instead to be equals, where you are equal as persons, and you have decided to give up the resentment and to offer goodness nonetheless, even though that person has hurt you. To reiterate, what is forgiveness? It's a moral virtue like justice and patience. 3 things. You've been treated unfairly, in reality without narcissistic distortion. You try to get rid of resentment and offer goodness without confusing that with toleration, forgetting, excusing, pardoning, or reconciling. Also, when you forgive, you always bring justice along with you. In other words, it's not either or. It's not justice or forgiveness. It's justice and forgiveness. And many people have a problem with forgiveness when they don't realize this. They think that when they forgive, they have to let the other continue to be unfair, or they have to enter into a dangerous relationship again when they forgive. That's not true. That's not what forgiveness is. And that's why this book is so important in terms of how it starts. It tries to clear up for you what forgiveness is and especially what it's not, so you do not fall into error. So with that in mind, let us now turn to chapter 4. And here we talk about the process of forgiveness therapy, our process model of forgiving. Because we only have 40 to 50 minutes with each other, I can't go into great detail, and I will leave it to you to read chapter 4, because it gives you the details of this process that we use characteristically in forgiveness therapy with anyone who comes in with any kind of an injustice, so that they can be healed of the toxic anger that can make them unhappy, that can make the relationships poorer, and that can basically destroy individuals, families, and communities. And so that's why forgiveness is so important, and forgiveness therapy is so important, to get rid of that anger so that individuals are not destroyed, families are not destroyed, and communities are not destroyed. Here's the gist of this process model, which you will find in Exhibit 4.1 on page 60 of chapter 4. We have 4 phases to the forgiveness process. The first phase is called the uncovering phase. And then what we're basically doing is we're uncovering all of the anger that the person has and usually is not aware of it. Most people who come into therapy oftentimes complain of certain symptoms, and it's not necessarily anger that is the primary symptom. They might feel low energy, or irritated, or anxious, or depressed. But when the therapist points out the various injustices the person has had to endure, there's a tendency to deny at first, not just the anger, but the extent of the anger. And so the anger has to be uncovered. That's why we call this the uncovering phase. And the point is to get the person, first of all, to see what happened without dwelling on it, without overly, obsessively focusing on what happened. And there could be one event that's unjust, or there could be a series of events. There could be a pattern that has happened. For example, with someone's father, who was overly harsh, oftentimes, in punishing the child when that person was 6 and 7 and 8 years old, and now they're grown up. They have all of this bitterness inside of them, but they cannot admit, for example, that they're as angry as they are with their father, because good sons and good daughters shouldn't be that angry with one's father, as an example. But sometimes it happens, and it's something that has to be faced courageously, with courage, you see, for someone to finally admit that they have enough anger, and a lot more than they thought, because of unjust treatment that may in fact be ongoing, and had been ongoing for years. And so it oftentimes takes weeks for a person to uncover the depth of the bitterness, the poison, if you will, of resentment that could be bringing them down. Then the second of our 4 phases is called the decision phase. And here we find in our research that people tell us the hardest part of the forgiveness process is to make a decision to forgive, because they're walking through a new door. It's a new experience for them. And it's scary. They're afraid of it. Because Because quite frankly, they don't know what's behind that door of forgiveness. And so what we do is we tell the person this in the decision phase. When you forgive, you will be going through certain exercises in understanding the other person, in understanding the one who hurt you. And what we want you to do is understand you won't be excusing, you won't be saying it's all right what they did, you won't be tolerating this. You may or may not reconcile, depending on whether the person is a threat to you. And you will be offering goodness of some kind to that person who has hurt you. And the way to start this in the decision phase is to make this commitment. Try to commit with me now, we tell the client, to do no harm. 3 little words, do no harm. The other person may have harmed you, but are you willing to walk out of this session with a commitment to do no harm to the one who hurt you? It's a major step. It's courageous. And it helps a person stand up a little taller, stand up with a stronger will to keep going with forgiveness therapy, because now they're already doing something positive. Then we come to the third of our 4 phases, this one we call the work phase. It's because we start doing the therapeutic work and we start with thinking. We start with cognition. Because it's a lot easier to change your thinking about another person than it is to change either your feelings or your behavior toward that other person. And so we start by broadening the vision of the client and how he or she thinks about the one who has hurt the client. And we do this by taking what we call certain perspectives. The first perspective is what we call the personal perspective. Who is the one who hurt you? Who is that person really? Should you be defining that person only by the injustices against you? Or is there more to the person than that? We use a certain phrase here, a certain set of words in this particular work phase. And the words are unconditional worth of the person who hurt you. The unconditional worth. We sometimes use the word inherent or built-in worth of the one who hurt you. The point is to see that this is a human being, yes, who has hurt you, but they are more than their actions against you. And so the personal phase begins this cultivation of unconditional worth of that person, or the inherent worth of that person, by asking a set of questions about the person who hurt you. Here are the questions. What was life like for the person who hurt you when they were a child? Were they ever hurt or wounded? Were they ever treated unjustly? Did they ever have bitterness in their heart that began to grow? What happened to them in childhood? Some clients cannot answer that if they've been hurt by someone with whom they don't have a personal relationship. For example, they were robbed by someone on the street. But most of us know the one who has been unfair to us, and most clients, therefore, can answer that question. And then we move higher in their developmental story, and we ask, what was life like for the person who hurt you when they were an adolescent? What wounds, hurts, the deep cutting issues that might have happened to that person when he or she was an adolescent? Might that have led to some weakness, some confusion, some pain that this person carried into adulthood? What was early adulthood like for this person? What wounds, what bitterness came to visit that person from others' unjust treatment toward the one who hurt you? What has middle adulthood been like for that person? So you fill in the wider, broader story of who this person is and the wounds that they are now carrying from unjust treatment. and you do it by taking the personal perspective. Then we move more deeply into what we call the global perspective. And the global perspective basically asks us, what is this person like as a person, sharing a common humanity with you? Will this person die someday? When this person is cut, does that person bleed? Does this person need a little bit of air to breathe and a little nutrition so that they can live? You share a common humanity with this person, including your woundedness. You both have been wounded in this world. Yes, they are the ones who have wounded you, but someone else wounded them. You share your common humanity of being internally, emotionally wounded by others. Do you think you both have unconditional, unearned, inherent worth? And then we come to a third perspective that the philosopher Keith Yandell, that's Y-A-N-D-E-L-L, Keith Yandell, a brilliant philosopher at the University of Wisconsin, shared with me. He said, Professor Enright, your views with forgiveness therapy are too narrow. You need what he called a transcendent perspective for clients, what he came to call the cosmic perspective. And for those people who have transcendent philosophies or faiths, who are the clients, we ask them such questions as this. Is there more to life than what we can see and feel and hear and taste and touch in the material world? Is there something beyond the material world? Is there a God? And if so, is that person made in the image and likeness of God? We only ask this if this is a person of faith. And then we ask, are you made in the image and likeness of God? Are you both made in that image? And if so, do you both have inherent worth? Do you both have built-in worth? Do you both have unconditional worth? And still in the work phase, when a person continually does the work of the personal, global, and cosmic perspectives, eventually and slowly, they begin to develop a little bit of compassion in the heart for the one who hurt them. They see their wounds. They understand the person's wounds. They appreciate what the person has gone through in their life. They don't appreciate the injustices, because that's something that needs to be corrected and should have been corrected and is part of a problem. But there's more to the person than their imperfections. And those three kind of perspectives help us to see a genuine human being in greater fullness than if we only focus on that person and the injustices that they have put upon you, upon the client. And that is a major part of forgiveness therapy, to continue doing the cognitive work to allow the emotions to catch up, to have what Joanna North, a philosopher in London, called the softened heart. Still with regard to the work phase, our third of four phases, we then ask the person who's gone through the personal, global, and cosmic perspective to what we call bear the pain. It happened. The injustice happened. We cannot reverse that. What are you now going to do with that pain? Are you going to throw it onto others? Are you going to throw your pain onto your children or to your loved ones? Because the one who hurt you threw their pain onto you. And it's possible that if you're not careful, you could throw your pain back to innocent others who weren't the ones who hurt you. Or you could throw your pain back to the one who hurt you, who will throw it back to you, and you'll throw it back to that person, who will throw it back to you. And then the conflicts and the pains could accelerate and become even worse. Are you willing to bear the pain, stand up with the pain, and live with the pain, and not give that pain to others? It takes a while for a person to think about that, to make a commitment to that. But when they do, we find in forgiveness therapy that the client becomes stronger. The one who is your client realizes that they can face pain and stand up to it. And then we ask the question, who are you as a person? Are you someone who is stronger than you thought you were? Who are you as a giver to those who did not give to you? And when you bear the pain, when the client bears the pain, they begin to change more positively regarding who they themselves are as clients, as people, as partners, or as workers, and their own self-esteem begins to rise. And then finally, in this work phase, we ask the person, because this is what forgiveness is about, it's about an act of mercy. We ask the client to think about creatively giving a gift of some kind to the person who might not deserve the gift. Remember, mercy is giving things that are not deserved necessarily in a justice sense. Examples might be you could donate to the person's favorite charity in their name. You can say a kind word to them or about them to others, or send an email to them or a text message with something positive. If they're deceased, you can still talk kindly about them or donate to a charity in their name. So you can give good things even to those who are not with us. And then we have the deepening phase, our fourth of four phases. In the deepening phase, we first ask the question, what meaning are you finding in the suffering that you have endured? Viktor Frankl, a psychiatrist, a psychoanalytic psychiatrist who survived World War II in concentration camp, told us that those who find meaning in their suffering were the ones who survived concentration camp in Germany and in Poland. In other words, we ask the client, what are you learning about yourself and about life as you continue to walk this path of forgiveness? And we find that people answer this way. I'm more sensitive now to the hurts of others. I'm more sensitive to the injustices in the world. I realize that most of us are part of the walking wounded, and I'm more compassionate toward others generally. I'm kinder to my children and to my partner and to those with whom I work. I am finding that the suffering I have endured is making me a more mature person, a stronger person, a better person. We then ask them in this deepening phase about what is their purpose in life, what is their goal. And oftentimes goals change when people walk the forgiveness path. And they become more interested in helping others with their pains and in becoming conduits of good for those who are hurting. The uncovering phase, the decision phase, the work phase, and the deepening phase. You can find it in Exhibit 4.1 on page 60 of Forgiveness Therapy. Now let's turn to page 87. And here we're going to talk briefly about the empirical studies, the research. You can find this in Chapter 5. Here we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 studies, and we now have more than that we have published with adults who have undergone forgiveness therapy. And in most cases, the vast majority of these cases, those who walk the path of forgiveness we have just discussed end up becoming less angry, less anxious, less depressed. They like themselves better. They get on with their lives. Here's just one example that's in Chapter 5. Suzanne Friedman, a professor at the University of Northern Iowa here in the United States, did a very courageous study with incest survivors. She worked one-on-one with 12 incest survivors, all women, and she worked for about an hour a week for 14 months with 6 of them. The other 6 were in the control group. And after 14 months of going through forgiveness therapy, with the process we just went through. And upon assessing them, they went from being clinically depressed, moderate to severely clinically depressed, to being non-depressed. In other words, they didn't just move in their depression, the depression ended. She then started the control group, who were still clinically depressed. They went one-on-one, 1 hour a week with Suzanne Friedman for 14 months. And at the end of that time, they became non-depressed. We then reassessed the first group after 14 months without forgiveness therapy, and they were still non-depressed. Learning to forgive the man who violated her, in each case, led to the women getting their lives back. One woman, for example, was so depressed, she could not leave her hometown to have a job of her dreams, what she called a dream job in another city. And she was too tired, too discouraged to take that job. She went through forgiveness therapy, reduced depression, and took her dream job. Forgiveness therapy literally got her life back. There are many other studies. We've helped men with cardiac compromise to improve their heart functioning to a degree. Forgiveness therapy won't lead a damaged heart to be a perfect heart, but there was more blood flow through the heart. And there are others. I will leave them to you to examine in Chapter 5. Let us now go to a specific clinical issue of the depressive disorders. And this Chapter 6 was written by my psychiatrist friend, Dr. Richard Fitzgibbons. And he makes a number of very important points. First point on page 106 is that depression in the United States affects nearly 1 in 5 of the United States population, 20%, right? He says 1/5. Yes, 1/5 of the, yes, I had the math right. 20% of the American population, adult population at one time or another, has enough depression for a psychiatrist to be clinically worried about the person. Think about that. 1 out of 5, 20%. That's a lot of people who are walking around with depression. And we know that a lot of times, he makes this point, that depression is comorbid, existing along with excessive anger. And that's just beginning to be understood and studied in the psychiatric community over the last 15 years or so. That when people are depressed, oftentimes they're irritated inside, they have bitterness, and they have what we're calling toxic anger or persistent resentment, oftentimes because of unfair treatment from other people. And what is one way to cut through this unfair treatment and to reduce this kind of resentment? Well, it's forgiveness therapy. And so this idea of comorbidity is very important for us all to keep in mind, that when you have a client who comes to you who's depressed, ask about their history of injustice. Ask who hurt them in childhood, in adolescence, in adulthood, and try to get a profile of those with whom they are still angry, perhaps denying the depth of that anger, and might need to forgive the person, not to accept what happened, not to condone or excuse or tolerate what happened, but to forgive a person and be good to them when they were not good to the client. Dr. Fitzgibbons makes the point that when you start forgiveness therapy with depressive patients, they oftentimes need quite a bit of time to uncover that anger. They're in denial about it. And so that's one theme that can thwart, if you will, make complicated the forgiveness therapy process if you, as a therapist, aren't aware that you have to take the time to uncover the depth of that anger, which oftentimes can be passively expressed by the person rather than overtly expressed, and at the same time is in complete or partial denial. So that's something to keep in mind for the uncovering phase as a possible issue. In the decision phase, Dr. Fitzgibbons tells us that many depressive patients don't even want to forgive. They don't feel like it, and they think their feelings are what should lead them into forgiveness, but that's not true. It's more of a willed decision. It's a cognitive decision rather than something felt emotionally. And Dr. Fitzgibbons gives what he calls prescriptions written out for his clients, where he asks them to, in the decision phase, think about the possibility of forgiving the one who hurt you, just to get used to the idea. And he gives more deeply held prescriptions in the work phase, where he has the person twice a day go through thinking about the person with a personal and global and cosmic perspectives once they get to that point. And that can take a while with someone who has the depressive symptoms. But remember, when we look at Suzanne Friedman's study with incest survivors, they were depressed, every one of them. And they ended up being non-depressed, and that held for the experimental group 14 months after treatment ended. So with that in mind, now let us turn to children. And that's one of the new areas of the work that I do with my colleagues. And what we do is we help teachers and guidance counselors to work with children and adolescents through stories. So here's one story that I have written. It is called Rising Above the Storm Clouds. It is for 8, 9, 10-year-olds. And if you notice, it says, Rising Above the Storm Clouds, What It's Like to Forgive. We basically have similes on forgiveness, where we say forgiveness is like rising above the storm clouds, where you are greeted by the sun and beauty after you have given up that resentment and offered goodness to the one who has hurt you. In forgiveness therapy, we, of course, with adults, talk about inherent worth, about unconditional worth. Well, we do the same with forgiveness education, where we talk about story characters who have been unkind, who have been unfair. And we ask, can we define the story character only in terms of their unjust behaviors? Or is there more to that character than that? Is there a broader vision we have to take on that character? And then we slowly bring that into the children's world, on the playground or at home. If someone pushes them down on the playground, are they more than people who push people down? Is that student more than someone with strong hands and an angry face? Could they also be wounded? Could they also be hurt by others? And when we do forgiveness education, we're about 1 hour a week for about 10 to 15 weeks in classrooms that are run by the regular classroom teacher. We see that as young as age 6, children's anger tends to go down. We do this in Belfast, Northern Ireland, where there has been political conflict for centuries. We've done this in the central city area of Wisconsin, where there is gang difficulties, and even young children are affected by that. And so it's a way to keep in check the bitterness, the resentment that could build up in children until they're adolescents and adults, and then it could come tumbling out to others. And the point of forgiveness education is to give children a tool to deal with their angers now, so that when they're adults, they have that tool of forgiveness, so that when injustices occur when they are adults, they know how to deal with that injustice. And without forgiveness education, I sometimes wonder, what do people do who have never really thought about forgiveness, who've never taken the time with forgiveness? And now let's say they're in a very difficult marriage, where there has been infidelity or physical abuse. And now the adult has to stumble their way to forgiveness. They've never become forgivingly fit. It's going to be much harder on the adult than if the adult has learned the lessons of forgiveness well in childhood and in adolescence, in their schools. Isn't schooling about helping people to survive well and to thrive in adulthood by knowing mathematics and knowing reading? Why do we neglect the emotions? Why do we neglect the tools of overcoming injustice by ignoring forgiveness education? I think it's a tragedy that we don't have more forgiveness education in more schools. Okay? And then finally, we have two more points. One is the measurement of forgiveness. And we measure forgiveness by what we call the attitude scale, or the Enright forgiveness inventory. It's 60 items given to adults. We have this child version, where we ask the adult about a particular person who has hurt them. And we ask that person who's filling out the scale to do thinking, answer thinking questions, feeling questions, and behaving questions. For example, regarding the person who hurt me, I feel warm toward the person. They, on a 1 to 6 scale, tell us whether they strongly agree, whether they agree, slightly disagree, disagree, or strongly disagree. Or I feel hostile toward the person. Those are two examples of affect items. Here are a couple of behavior items. Regarding the person, I have in mind here, I do or would show friendship toward the person, 1 to 6 scale. Strongly disagree, strongly agree. Regarding the person, I do or would neglect the person. So you see we have positive and negative items. And so the scale ranges from 60 to 360, and any range in between. The average score is around 250. And what's interesting about a scale like this is when we gave this scale like it, in Suzanne Friedman's work, those who forgave, those who got their lives back, did not go to the highest level of the scale. It was a little different scale. I'm not going to go into those details, but they went about to average. But they started very, very low. And so my point is, for people to get emotional relief from forgiving, you don't have to be a perfect forgiver. You can be a quite imperfect forgiver, getting about to the middle of the scale, and very good things happen, where you can end up being non-depressed and having the anger melt away and like yourself better and like other people better. Now we end with skeptical views. Forgiveness is not without its critics. In fact, forgiveness has many critics. Here's some issues. When you forgive, you become inferior, goes one of the criticisms, because you're lowering yourself. You deserve better than to forgive. But forgiveness does not throw justice away, and that's the error in this criticism. When you forgive, you can stand up and you can say, yes, I forgive you. Yes, I'm going to get rid of my resentment toward you. I'm going to try and be gentle toward you, and I will do no harm toward you. But I'm going to ask you to change. I'm going to ask you to alter your unfair treatment, what wounds me, and here's how you wound me. And when you forgive, you might be able to approach them in a more civil way, in a more gentle way, and get more out of that. Some people claim that when you forgive, you become more hypersensitive to hurt, where you begin seeing hurt where there really isn't any, because you become so attuned to the wounds of the world that you overdo it. But I don't think that's a good criticism, because what forgiveness does is ask you to realistically, concretely, specifically look at the hurt, look at the injustice, and to call it what it is, and not distort it. In fact, when we don't forgive and when we deny, when we're in denial about our hurt, when we're in denial about how much the other hurt me, that's when we might be prone to distortion. And some people think that when we forgive, we're opening ourselves up to danger. So we might go back into that unfair situation with the unfair person again. But remember, forgiveness and reconciliation are not the same thing. Okay? So those are just some of the criticisms against forgiveness. And oftentimes I find Those who have critical views against forgiveness are misunderstanding something about it, like equating forgiveness with no justice seeking at all, or equating forgiveness with no possibility of anything but reconciling, where we have to reconcile with the other. And so when you realize that you forgive, you do bring justice along, and when you forgive, you do not necessarily reconcile, these kind of criticisms melt away. Finally, I'd just like to mention another book that I have called The Forgiving Life by the American Psychological Association as well. And it's for the general public or for clients. And in the end of that book, the last chapter, we talk about legacy, what you will leave behind in this world when you die. And the challenge is this. When people are treated unfairly, their anger can build up to such a degree that if they do nothing about that anger, they could leave that anger in this world when they die by planting it in the hearts and minds of others, who then go on to plant that anger in the hearts and minds of yet others. And the anger that you have in your heart today could be alive 100 years from now, passed from one group to another or one generation to another, where that anger could be alive, unless you do something about it. When you forgive, when you offer that goodness of kindness, respect, generosity, or love, that kindness, respect, generosity, and love may be living in other people's hearts 100 years from now. What will you leave behind in this world when you die? Will you leave your anger to others? Or will you leave more love and kindness and respect and generosity? Forgiveness gives you the opportunity to leave more love in this world. And when you engage in forgiveness therapy, you are giving others that opportunity as well. I hope your questions and discussions with those in your auditorium now are fruitful. And if you would like, please email me. You can find my email at the University of Wisconsin-Madison in their directory. And I'd be glad to talk with you. Thank you very much.